you for coming this morning. This is an opportunity for us to talk about the Affordable Care Act, the expansion of Medicaid in North Carolina, and also for us to make sure we understand the interests of North Carolina and its citizens at this critical time. You know, we're going on a summer vacation for all intents and purposes, and we have a major issue that has not been resolved. And folks have continually said, we're waiting on the courts, we're waiting for something to happen, we're waiting for the budget to be in better shape. All these things have come and gone, and we still have not taken the action necessary to help over 300,000 North Carolinians who don't have any other choice, and to take advantage of the opportunities we have for so many folks in North Carolina who could be employed in this effort, and to take advantage of it for the citizens of North Carolina who are sending billions of dollars to D.C. every year to go to other states, and we continue to fall behind. So I'm Democratic Leader Larry Hall in the House of Representatives here from Durham County, and I have with me this morning the President of the North Carolina Conference of Branches of the NAACP, Reverend William Barber, as well as Adam Linker, and they'll both be talking about this travesty we have here in North Carolina of not taking advantage of what is rightfully the citizens of North Carolina's right to health care and this employment and economic benefit. Gentlemen.
Thank you so much. Let me thank you so much, Leader Hall, for having us here today, and I'm joined again by Adam Linker with the Justice Center. Nicole Jones, if you can come up, who's also with the Justice Center, and others, and also Attorney Jamie Phillips, who's our policy person with the North Carolina NAACP and the Forward Together movement. As you know, this afternoon we will be having tomorrow, Monday, on Wednesday, and the focus will be on equal protection under the law, and part of that, where we believe equal protection is being denied, is as it relates to the expansion of Medicaid. Whenever we come to the legislature building, Leader Hall, we do not come merely in terms of, we never come in terms of partisan politics. We come in terms of our deepest constitutional and our deepest moral values. So let me just start with the language and the rules that are supposed to guide what goes on in these halls and what our governor swore to uphold. Article 1 of our Constitution says that all political power is vested in and derived from the people, and it should be instituted solely for the good of the whole. Section 5 of Article 1 says every citizen of this state owes paramount allegiance to the Constitution and the government of the United States, and no law or ordinance of the state in contravention or subversion thereof can have any binding force. We're not supposed to pass laws in this place that are contradictory to federal law. Article 11, Section 4 says this very clearly, and it's been in our Constitution 147 years. Beneficent provision for the poor and the unfortunate and the orphan is the first duty of a civilized and Christian state. These are not the words of the NAACP or the moral movement. These are the moral words and the constitutional words that every legislator, regardless of party, and every governor swears to uphold. Each one of them put their hands on the Bible, and they make a big deal out of it. Well, Isaiah 10 says, woe unto those who make unjust laws, those who issue oppressive decrees that deprive the poor of their rights and withhold justice from the oppressed of my people. Matthew 25 says, I was sick and you did not visit me. For 2 years, this governor, Governor McCrory, and this legislature, first under the leadership of Tom Tillis and Phil Berger and now Tim Moore, have engaged in modern day interposition and nullification. And that word was used by Dr. King in his speech in 1963 when he talked about how Southern governors, particularly Governor Wallace at that time, were literally blocking black people, particularly in the South at that time, from their rights under the Constitution and from the protection of federal law. We believe we are seeing a form of modern-day interposition and nullification because this governor has signed and this legislature has passed laws and they are withholding benefits provided by the federal government, paid for by the people of this state, that have been proven to be constitutional. This administration has gone a long way in trying to uphold this interposition and nullification. They have trumped up the failure of Medicaid, while on the same day in 2013, the governor was talking about the failures. U.S. Senator Richard Burr was at an event touting the system and even attending an event where he gave an award, and here's the quote, to recognize the public-private partnership quality and efficiency of serving the state's Medicaid population, and particularly the high quality of care, talking about our Medicaid system, it delivers to patients in rural areas. In fact, one researcher from our major universities who by the way, were not allowed to testify before the legislature. Media, remember this. People were not even allowed when they denied Medicaid. It happened so fast in committee, it was at warp speed. But one researcher said that the national data from the Kaiser Family Foundation have shown that North Carolina's Medicaid program costs have increased at the slowest rate in the nation, and per capita costs are the lowest in the Southeast. Multiple states have asked North Carolina for help building programs that look like Community Care of North Carolina. Then this researcher, John Oberlander, said there is no crisis in North Carolina Medicaid, and there is no national crisis in Medicaid. The idea that Medicaid spending per person is spiraling out of control is not true. And yet, this legislature, under the current leadership, Republican leadership, and the governor, continue to trump up these failures as a way to further this interposition and nullification. They don't do this anywhere else. And Duke Energy, for instance, has serious problems with coal ash. They don't say, let's stop funding Duke and just stop giving them that tax cut. They fix the problem, and they still continue to support. We know that fracking has a lot of problems, but you did not see them say because of the problems of fracking, we're not going to pass a fracking bill. Only when it comes to the poorest and the vulnerable. Now, here's what has happened. This modern day interposition and nullification has kept 500,000 North Carolinians. And it's important, we're talking about working poor people. Another misnomer, another way they've tried to turn public opinion against it and say, well, these are just poor people who are just not doing anything. Working poor people and the disabled, 500,000 from getting health insurance through Medicaid expansion. According to research, this modern day interposition and nullification by this governor and legislature has resulted in probably thousands of North Carolinians dying who did not have to die. Who did not have to die. All because of some racialized and extreme partisan politics against the president and federal positions. 45% of those in the coverage gap are white. 45%. 37% are black. 18% are Hispanic, which means 55% of the people in the coverage gap are black and brown. Black and brown, according to one analysis. The flag may be waving in South Carolina, but interposition and nullification and the history of the politics of denial are alive and well in North Carolina. And while we are traumatized by a plot that causes sudden death, we must also be terribly concerned about policies that cause slow death. Slow death. Thousands have died, all because of racialized and extreme partisan politics against the president and federal positions. Now finally, we've seen this pattern in the way this legislature and government has passed law, not just happen with Medicaid, but the way they have attempted to nullify the rights of the LGBT community, despite the fact that over and over now the courts is being very clear, the way they've attempted to nullify the rights of the immigrant community, of women, and the way that they've attempted to nullify our voting rights. All of them represent a pattern, along with the denial of Medicaid expansion, of modern day interposition and nullification. And here's the final piece. Other state governments, even some led by Republicans, have accepted Medicaid expansion. But here in the South, the native ground of poverty and need, North Carolina's Governor McCrory and Barber and Moore and formerly Tillis have chosen to follow the pattern and practice of Southern state governments of the past and the present by being on the wrong side of history, the wrong side of justice, the wrong side of mercy, the wrong side of grace. They have chosen to be for nullification rather than doing what is best for this state and her citizens. Today, we say to the government and to the leadership of this house, this chamber, it's time to put up your swords. It's time to put up your stall tactics. It's time to put up your partisan schemes and save the lives of North Carolinians from Manio to Murphy and pass Medicaid expansion. You don't have to wait another day. You don't have to allow another death. You don't have to allow another hospital to close or go and be in trouble. The governor said on yesterday he doesn't have an appetite for inaction. Well, act, governor. Act, members of this legislature. He wants support to pass a tax bond to build infrastructure that is needed. But his logic is flawed because he will not accept already provided federal subsidies that will not cost the state one dime for 3 years and then only 10% afterwards. This administration and legislature wasted time and money with this interposition and nullification. They wasted time passing unnecessary tax cuts for the wealthiest and raising taxes on the working poor by increasing fees and taking benefit. This is what they have done instead of performing their first duty, and that is to make provisions, beneficent provision, not just provision, beneficent provision for the poor and the unfortunate and the orphan, the first duty of a civilized and Christian state. It took them less than 30 minutes in committee in 2013 to deny Medicaid expansion, first vote. They could fix this today. They should fix this today. And just as a matter of stats, and then Adam, you can come. Speaker Moore represents Cleveland County. There are 4,856 persons in Cleveland that would be covered. And the increase in business activity would be $188 million. Barber represents Guilford County. 26,539 residents would be covered by 217. And the increase in business activity would be $1,994,900,000. He also represents Rockingham County, and in that county, 4,408 people would be covered, and it would bring $126 million of increased business activity. McCrory comes from Mecklenburg. 48,474 citizens would be covered by 2017, and it would bring $2,916,900,000 in business activity. Wake County, where Stam is $33,867, and over $3 billion in increased business activity. So we call on today families whose loved ones get sicker or die because of this denial, because of this modern day interposition and nullification, to consider legal action. If your family member dies or gets sicker because you're being denied, we believe it's unconstitutional. And to make your voices heard. We're calling on counties where hospitals are closing or hospitals are in trouble to join hands, black and white, male and female, LGBT, Republican and Democrat, and say it's time to put away this foolishness and expand Medicaid. And we call on the governor and the legislature in truthful love and in the spirit of decency, morality, and concern for all citizens of the state. Put down your swords of nullification. Let's join hands and pick up the spirit of common humanity, stand together, and swiftly bring Medicaid expansion to North Carolina for the good of all the people. Adam.
I'll be brief this morning. We wanted to say this morning that Governor McCrory has said in numerous interviews, as you know, that he was waiting for the decision in King versus Burwell at the Supreme Court to make a decision about Medicaid expansion. Well, that decision has come and gone now, and so we're here today, and we're here at Moral Monday, and we're going to be here in future rallies and press conferences to call the question. It's time for Governor McCrory to say whether he supports covering the 500,000 working poor who need affordable coverage, or does he not? That's the first question. Does he support that, or does he not? Then, if he says he doesn't, well, we want to know that now. If he says he does support covering those folks, then he has two options. The least expensive, the easiest, the most efficient way to cover those folks is by expanding our Medicaid program, which, as Reverend Barber said, is a working system through Community Care of North Carolina. His other option is to come out with his own specific state plan. If he wants to do that, there's no reason he needs to wait. You don't need to wait for reform to come out with a plan. We need to see the plan if he wants to pass his own plan. If he, the problem is he keeps talking about work requirements and other things that are false arguments.
That's right.
Federal Health and Human Services has said that they will be flexible in a lot of ways. The 6 states that proposed state-specific Medicaid plans all got approved. These are Republican governors who have proposed them, and they've all been approved. Sticking on work requirements is a political excuse. It has nothing to do with policy. Federal HHS has said they don't have the authority to approve work requirements because the Medicaid waiver statute says that the point of Medicaid waivers is to improve healthcare delivery, improve access, and expand coverage. Work requirements do none of those things, and so the federal government has no authority to grant work requirements in a Medicaid program. So if the governor is going to stick to that, it's just an excuse to kill the program and blame the federal government. It means he does not support covering those 500,000 working people. Now, who are those people? We've met them all over the state. We travel the state. NAACP travels the states and meets these folks all the time. We've brought many of them to Raleigh. It's people like Dana Wilson, who you've heard from here. It's people like Jolanda Ware in Greensboro, who we can give you contact information for any of these folks. And it's like most recently a woman we met from Snow Hill, Linda Dunn. She is actually of Medicare age, but she had to go back to work because her daughter is in the Medicaid coverage gap, and she has mental health issues that she needs addressed, but she can't get them addressed because she does not have health care coverage. She has mental and physical needs that need to be addressed. So her mom has gone back to work, her dad has gone back to work in the years when they plan to be retired to provide for their daughter and try to get her the help she needs, which is very expensive. There's no reason that Linda Dunn should have to go back to work to take care of their daughter. We know that there's an easy way to provide coverage to people with substance use disorders, with mental health needs, and that is to expand Medicaid. So the simple question is Governor McCrory for or against it? That's the first question. He's very squishy on that. We need to know if he's for covering these folks or is he against it. And then we can have the discussion of, why doesn't he expand Medicaid, or why doesn't he do a state-specific plan? But the first question is, does he support it or does he not? Thank you.
One more piece and we'll take questions. It should be noted, and I want to be very specific in mentioning this, in terms of who actually is being denied, because that's something that's not being talked about. Veterans, according to the Robert Johnson Foundation, are being denied. 59,000 of the people being denied are already employed in construction jobs. 56,000 are in food services. 43,000 are in cleaning and maintenance jobs. 34,000 in transportation jobs such as buses, taxi drivers. 18,000 in personal care such as barbers and child care workers. And 16,000 in health support such as home health aides. And in other words, people who are taking care of people who may have Medicaid who can't get it themselves. The question is, does the governor support these people, right, Adam? Does he care about veterans? Does this legislature care about veterans and construction? Stop this false notion that entitlement, and that becomes a negative word after the Southern strategy started in the 60s, that somehow this is a bunch of people getting freeloading, or that it's just minorities. The fact of the matter is Medicaid expansion helps working poor people and otherwise disabled. And let us not continue to be on this list of none. Indiana expanded. They're led by Republicans. Iowa, Kentucky, Michigan, New Jersey. I just left New Mexico, Ohio, Arizona, Arkansas, West Virginia have all expanded. In fact, Governor Kasich out of Ohio literally said that anybody who would not expand Medicaid is engaging in modern-day war on the poor. That's a Republican governor. It's time. Adam, would you stand up, Nick, and answer any questions? Representative Holmes, if the media has any questions.
Okay, we'll take them now.
Well, Leader Hall, many of your fellow Democrats voted for a plan in the House to restructure the way that Medicaid is run in the state. What do you say to the argument that, some of you have pointed this out here in the last few minutes, the argument that that some people who say that some Republicans who say that they might support expansion, they say that they can't even think of expansion until they reform or they restructure the way that Medicaid is administered right now?
Well, that probably was already addressed, that we don't outlaw everything that we don't 100% regulate without error or without need of improvement. So again, why is it just in this instance we do that? We're talking about expansion. We've got one of the best systems. The stats already show it. This has been a moving goal line, as we talked about. And so even when Speaker Tillis was here and he was with the governor, they said this needed to be revisited. Representative Tillis is now a U.S. Senator. He's gone. And we're still finding reasons to not do this. Then we said it was going to be a court decision. We're waiting on that. We're already doing it better than virtually any other state in America, administering the program. So these excuses you may call them, at some point you have to stand up and tell the people of North Carolina, why do we not allow you to get the benefit of the tax dollars you are sending to Washington and let everyone else that we claim we're going to compete against with incentives get those benefits so they can beat us in the effort to create jobs. Why are we not gonna let citizens have access to health care so they won't end up in the emergency room and burden the rest of the population with the most expensive care even possible? None of this makes financial sense, business sense, and people just are not being true to their word. So you can't keep running and hiding from the truth. The truth has been laid out time after time. It's time for people to take leadership and say, I'm opposed to it, and I have a plan, which they don't have a plan for expansion. If they do, it's the best kept secret in Raleigh, for sure, okay? So they don't have a plan, and they keep making up different excuses once one is knocked down, one after another, as to why they're not acting on the plan that's available. So it's unconscionable. We're talking about going on vacation. We're going on vacation while people die. Think about that. And we have the power at no real expense to us to resolve that problem, but we're going on vacation. We planned to go on vacation. We didn't plan to get this resolved. We got a continuing resolution to continue the budget because we decided it was important. All we've done is made excuses and made up new excuses when the old ones were eliminated. So I don't think there's any excuse for us not getting expansion done as well as any reworking of the system. Any other questions? Yes, sir.
What I want to make sure to me, and I'm glad you raised that question again, that's why we say this is a pattern. The extreme leadership of the governor and current leadership of the House, and I don't call them Republicans because, see, it was a Republican who first called for health care for all Americans, Teddy Roosevelt. And other Republican governors have done this. And their states, they had more problems, literal problems, because they were asking us. That's the point we want to drive home. Our U.S. Senate, on the one hand, lifting our program up, while here in the media, they're tearing it down. But it's a pattern. They put out and said that voter fraud was a problem. No, it's not a problem. That's just a part. That's a propaganda tool to get the media and others to talk about there's this problem when there's no problem. They say that about teachers. They said that about the LGBT community, that somehow the whole world is going to fall apart if people's equal protection under the law is protected. It's all smoke screen. That's why when we come with the Constitution. Constitution says that the first duty. In fact, before they fixed all these other things, according to the Constitution, the first thing you're supposed to deal with is beneficent provision for the poor and unfortunate. That's what the Constitution said. Secondly, the site, you all know it, it lays out that if anywhere else there was a program that was going to increase business activity by $2 billion in Charlotte, if it wasn't Medicaid expansion, and if it hadn't been done by a president that they don't like, that would be touted. We're going to pass this program, and we're going to create, in just Mecklenburg and Wake County alone, $6 billion of increased business activity. What happens when, so that's why Adam's question is clear. Do you really want to help construction workers and food service workers and veterans and transportation workers and personal care and health care? Do you really want to save lives? Or do you want to be in the same line? Does North Carolina want to line up politically with South Carolina? We know what that legislature does under the flag. They deny Medicaid too. Do you want to line up with Alabama? Do you want to line up with Mississippi? Do you want to line up with almost all the southern states? Or do you want to, on this issue, if other Republican-led states can step out of it and say, listen, we don't agree, but on this issue, it's right. I don't think anybody insulted the president more than the governor of Arizona. I think wasn't she the one that put her finger in his face? And yet when it came to Medicaid expansion, and she looked at the lives, she looked at who it would impact, she looked at the hospital, she looked at the money coming in the state, she looked at revenue, she took that finger right down and extended a handshake, at least on this issue. Why can't we at least do that in North Carolina? Yes, sir.
Reverend Barber, if you could respond. And admittedly, I'm bringing up old news here, but last session, I can't remember which chamber it originated from, I think it may have been the Senate, they said that they crunched the numbers on the Moral Monday agenda, and they talked about it costing billions. And I remember at the time that, those figures were disputed. But of course, Medicaid expansion goes hand in hand with that. And to anyone who's at home who maybe feels along the lines of that it's not cost effective, how do you respond to that?
Great. First of all, they told a bold-faced lie, and I don't say bold-faced often, but that's why we had the Tax and Policy Center to examine the Moral Monday agenda, and when it was done by a nonpartisan group, it was proven that that in fact it was revenue neutral, and if done right with the proper kind of equal fairness across the board on tax cut, would actually produce a surplus. Number two, we are clear that trickle-down economics has never worked, where you claim you cut tax for the wealthy, and somehow it's been proven. Even people who once supported it said it's foolish, voodoo economics. That's what they've been engaged in here. We believe in investment economics. You invest in education, you invest in health care, you invest in infrastructure. And when you make those investments, you not only benefit our human capital, but you benefit the state itself. And that's why we bring this study every time we talk about Medicaid, because we knew that some people claim that if you talk about it from a personal individual, well, these entitled, these are poor people that are lazy, they're not doing anything, we're just giving money away. Well, first of all, we destroy that argument by showing, no, you're talking about veterans and construction workers and food service workers and healthcare workers. But more importantly, it's been proven that Medicaid will increase business activity, will increase tax revenue, will increase health care, and if people are healthier, they can work better, they can be at work longer, will increase jobs, and every state that's used it, I think there was a recent study out of Kentucky that says those who actually receive Medicaid, the system is flourishing. That if you're saying that the money's not there, the systems are actually flourishing and getting better. And Adam can speak to that as well.
Yeah, I'll just say simply that Kentucky had the Medicaid expansion, and the governor there contracted with a private company to examine what it did there. And then he held a press conference where he said, every economic argument against Medicaid expansion has now been buried under an avalanche of facts. And so he said it's just not debatable anymore. The economic impacts are there, and we've seen that, that all those predictions came to fruition.
Let me make one other point on that. In especially rural areas, and Representative Hall will correct me, schools and hospitals are critical to job recruitment. Schools and hospitals are critical to job recruitment, industry recruitment. Hospitals, particularly rural hospitals, are being hit hard by the denial of Medicaid expansion. We've already had one to close, and I'm understanding now, maybe up in Davie County, there's a possibility of another, are hospitals that are suffering and closing. How are you going to recruit jobs and businesses in those areas if you are denying resources, denying the kind of expansion that's going to help those hospitals in those areas sustain? Ask the Republican mayor of Belhaven what happens when you don't expand Medicaid. Ask him why he walked 283 miles to Washington, D.C. Ask him how he felt when he had to walk to Virginia to meet with a governor because the governor here wouldn't meet with him. Ask him go to Belhaven and talk to the man of the woman who died in a high school parking lot 10 minutes from a hospital that once was open that closed because of denial of Medicaid. Portia Gibbs. Go ask her husband. She died in the hospital parking lot, and she's white. Ask the minister in that community, who's a Methodist pastor, father of 5, who admittedly says, I'm not a Democrat, I'm not a liberal, but who, if that hospital hadn't been there, he would have died because he had a heart attack, and they were able to revive him at that hospital, and it's gone. And when Biden first closed that hospital, they said, and they tried to take it back, but they told the truth first. They said the denial of Medicaid expansion has undercut our bottom line to the point that we cannot sustain the hospital. That's how I would answer. Any others? Thank you so much. God bless you. Take care.